today we will be doing a face anatomy video. So what I've prepared is certain muscles in the top area of the face. We'll not be doing the lower part, just about 6 muscles on the top. We'll go through how they look, where the fibers are going, the motion that the muscle is doing, and to what particular activity they do serve to express certain emotions. What we will start with is actually frontalis. So frontalis is a muscle that covers the skull from back and it extends to the front of the forehead. So it actually goes from about the arch of the eyebrow right here. It just goes up and then it also goes from here about there to just up the forehead. Okay, so this is sort of where we do have the frontalis muscle. It's on both the sides. So I'll also make the other one. And then it goes from about here to sort of there. I'll just make the lines a little bit more smoother. So what the frontalis does, it helps us to raise the eyebrows and it wrinkles the forehead. I'll now show you how the fibers are going. So they go from the top to the bottom, sort of. So the fibers just go up like this. And also on the other side, I'll just sharpen my pencil for that. And so the fibers here go up as well. This particular muscle is called occipital frontalis, and it helps us to express shock or surprise. So I'll just now ask a lovely model if she could just raise her eyebrows sort of in shock, like you would be really surprised. Can you? Like so that it really like wrinkles right there. That's perfect. So if you can do it one more time, you'll just see that it really contracts, and then when it's released it will extend again. So this is the muscle and its purpose. So the next muscle that we do have will be procerus. Procerus starts at the bridge of the nose. It goes from about here and it goes up to the forehead, just like this, sort of. Now the fibers here go again in sort of this direction. Like they track. Just use that one. Like this, 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 and that. And it just goes down like this. So the procerus is right between the eyebrows and the bridge of the nose, right here. And it depresses the medial angle of the eyebrow and it wrinkles the skin over the nasal bridge. So this is when we are frowning. So if now I can just ask you again to sort of do frowning, you can just see the muscles really again contracting. You can release. Now one more time. Great. You can just really see it moving. That's perfect. Thank you. So that was the procerus. That just helps us with that. Let's just continue with corrugerator supercilii. So corrugerator supercilii actually goes from about here through the eyebrows and attaches about here. So I'll just again make, so you might already see where this is actually going. And what kind of movement it will actually be doing for us. So I'll just go like this. Perfect. So this is corrugerator supercilii. Just move this a little bit. And it helps us with inward and downward movement of the eyebrows. It actually helps us to express sadness and pain, worry, or discomfort. I'll just do the fibers again. So the fibers go like this. They go in the upward or downward and inward motion of the eyebrows. I'll just make a few more fibers here on the forehead as well, so you can really see where That's nice. Good. Perfect. So, if I can now just ask you, can you just imagine when there was any kind of physical pain in your life? Sort of the face that's like, can you just express it? Yeah. You can just see that it really moves. You can just let it go and try it one more time. You just really see that it's moving inward and downward again. That's perfect. Thank you. So, this was the corrugator supercilii. So we'll now just move to yet another muscle, and this time it will be nasalis. So nasalis muscle is on the nose area, so that's why nasalis. So it consists of two parts actually. It consists of transverse part and a lower part. So transverse part actually helps us with narrowing the nostrils. So it's basically when we sort of like breathe in really fast, they will just sort of like constrict. And when we, but it's just like very sharp inhale basically. I'll just show it. And then we have the alar portion, and the alar portion is around somewhere here, around the nostrils basically. So I'll just mark the nasalis now. It just goes all over the nose. It starts like from the bridge again. It starts from around here and goes down and just goes down the nose. Same thing here. Basically you have here the cartilage. As you can see, it is movable. So where there is the cartilage, that's where the muscle ends. It just goes down around the nostrils. So it goes even all over the nose. The muscles are always, I'll just move your head a little bit this way. The muscles are actually always connected to the skin with connective tissue. It's connective tissue. Good. So just move your head back to the center again. That's great. And sort of goes like this. Right like that. Now the fibers on the nose go in the direction like that, or like so. They just go down to the nostrils. This is just perfect. Good. Now, the lower part, which is approximately this, approximately this, helps us with widening or dilating the nostrils so that it really helps us breathe, especially when there is adrenaline. And what it is actually used for is sniffing or when you're squinting your eyes. So can you just pretend for me now that you're sniffing something like really unpleasant? Yeah, now if you just keep it there, can you just see how it, yeah, perfect, release. It just like really shortens and then releases. Perfect. The same goes if we are squinting with our eyes, like you were trying to make them small and just like really focus on something. You sort of do it as well, a little bit less, but you do. So this is about the nasalis muscle. So let's now just go to, and this is going to be probably the most fun one to make, orbiculus oculi. So orbiculus oculi is actually the muscle that goes around the eyes, and you can pretty much palpate it like you have a bone around your eye, the eye socket sort of, right? So that's exactly where the muscle actually is, and it goes in orbit, so it's circular sort of. So we'll just go with the muscle. It just goes around the eye really. And what it helps us to do, I'll just palpate, okay. A bit more like here. So it might look a little bit like raccoon right now, or someone who has been stealing in a very old childhood fairy tales, but it just goes like that. It's much easier or harder to just really paint on the face or draw on the face, because the skin is not as tight as on other places. So I'll just grab a cotton swab and just do some adjustments. So I'll just sort of remove it here because I don't like it there. It's a little too thick, the line. That's wonderful. Okay. And so now I'll just do the fibers. And the fibers go around the eye in the orbit as well. They go sort of like this. And then they go under the eye like that. That's perfect. just sometimes if you look at the eyes, you can just even like see the muscle fibers on the eye. And just right under, because wrinkles actually form around our muscles and how much we use them, you know. So I think that's good. So this is the orbicularis oculi. It is a ring-shaped muscle, so it's really like in sort of a circular shape, and its primary function is to close the eyelids. So we use it when we're smiling or when we're frowning. It also helps us with tear drainage. So if you're crying, the muscle actually helps you with that. Can you now just open and close your eyes? So you can sort of see, if you can just again open and close, it will just see that the muscles are moving a little bit. Can you smile for me now? You can see just it lifts up a little bit right there. Can you smile a little more? Yeah, good. Now you can close your eyes again. Perfect. And we'll go to yet another one. So let me now just show you the last muscle, and that is temporalis. So temporalis actually is a huge muscle. It connects about here and is on the side of the face. So temporalis, of course, is related to the temple. So the muscle is sort of like fan shaped, and it goes even behind the ears. And then we have a tendon, and the tendon goes down and attaches to the lower jaw, known also as the mandible. So I'll just show even on the other side. It goes through the jaw and attaches here. And then it just helps again with the tendon. So what it does, or its primary function, is actually mastication, which means chewing. So if you're chewing, it helps you with the movement of the lower jaw, which goes like up and down to put your teeth together like that. It also has some other functions. So the first one we talked about is called elevation. Then you have retracting. So basically, if you put your jaw like forward like this, and then again backwards, this is like retracting. It helps you to move the jaw back. So it's like this. Yeah. So it's actually the temporalis right here. If you try it at home, you can even like take your hands and put it on the temporal part right there and try to just move the jaw. Can you feel it? It just sort of like starts to, yeah, move there. So that's what it's good for as well. And then we have also lateralization, which helps us to sort of move the jaw from side to side when we're chewing. So if you're chewing, you're not chewing symmetrically, right? You're chewing according to where the food is. So it basically helps you to move the jaw to the side a little bit. So sort of like this. Yeah. So if you again put your hand here, you will just really feel it mostly here. on the temporal part. Yeah. Okay, that's good. So this is the temporalis. It really has a crucial role in the chewing and mastication, if you like. It is on the lateral side of the scalp. The lateral means on the side. Okay, so this is about it. I maybe will just show how the fibers go. So the fibers sort of go like this, like from this direction, sort of. It looks like, I don't know if it's called mussels in English, like in seafood. When you have the shells. So the mussel sort of goes like this. And then it goes like that. Okay. So what we will do now, we'll actually be removing it. So if you just want to stay for this ASMR part, you can. Lastly, we'll just remove what we did. So what I'm using is a hydrophilic oil, so it goes well down with water. It will just easily remove what we did. So I'm just gonna apply some of the oil here and there. Now I'll do just circular motion. And as you can see, it goes down just really, really easily. Okay. So now we are just removing the nasalis, now the orbiculus, oculi, here frontalis, right? You already know that. So there we go. Just now use the sponge to remove some of the drawing that we did previously. And as you can see, it goes down quite easily. Okay, now here. This is just a removing of the frontalis. Now again the orbicular oculi. So I'm just trying to get rid of the first sort of like layer so that there is not so much oil on the face. over the eyebrow. I'll just clean it with water. I'm just taking a little bit more of the oil and just getting rid of the rest. Really go into the temporalis. I used a little bit less of the oil than previously. That's good. Now on this side, just really getting even into the hairline, so that it's just not there anymore after we are done filming and cleaning. Good. Now just the eyebrows. Going even underneath the eyes. Wonderful. And now the eyelids as well. Okay. Okay, now just right there. We'll just now do the one last cleaning with the sponge soaked with water. We'll just clean all the there's a little bit of red between the eyebrow. That's good. And just going around the eye. Yes. Now here. A little bit into the hair. Now just here. I'll remove that from the eye. We are almost done anyway. Now just to make it finally completely clean, I'll just take the sponge, which is And good. And this is